Dominic Copeland, 32.
29.
Well, you're only kidding yourself, Don. Found in the gutter over indulging in Zambuca last night. Is there 500 mils of Lucasade, some cold pizza, and 2 vitamin C tablets. He's out drinking with Fletcher and Ange.
Oh, fix up looks sharp, mate. Him, young Fletcher, is already on the warpath this morning.
Oh, please. He had more than me last night. He's going to feel just as rotten.
Wouldn't bet your life on it.
And what time do we call this?
I call it...
I don't actually want to know what the time is. You're both late.
You're not my boss?
No, I am his.
How on earth do you not look and smell as rotten as I do today?
Because I can handle my drink. And there's no hiding up on Keller either. Rick wants you down here.
No, I don't deal with the great unwashed.
Well, you either take up your grievance with Mr. Griffin, or hopefully I'll see you on the shop floor, preferably 10 minutes ago.
Your hangover is coming, Fletch, OK? You can't hide from it.
He's right, we are pretty late.
I suppose that's my fault, is it?
Well, you did ambush me in the shower.
Yeah.
I need to get to work. I'll see you later.
OK.
Right, folk.
Hello, Mr. Hudson.
That's not funny.
Come on, we've got work to do.
Yeah, I know. Sasha's in the middle of doing an organ transplant, and yet Rick wants me down here. It's a waste of a good surgeon. It's like Meryl Streep agreeing to be in Geordie Shore.
Oh, is it lonely up there on your pedestal?
Hey, can I get some help over here, please? Hey, this is Lily Geller, 52, complaining of heart palpitations, dizziness, nausea. GCS is 15, but was 10 when they picked her up.
Dr. Gallo?
You've got to be kidding me.
You two know each other?
Well, you catch on quick. You can stay. Woo! Benjamin, you too. Great.
Hello, Dr. Geller.
Oh, good job I'm already lying down.
Can we get Dr. Geller into a bed, please? What?
Not working in close proximity.
It's a one-off.
24 hours a day with you. One of you needs a mother.
Tell me about it. The amount of times I've told these two the couples counsellor would make an absolute midnight.
Nurse Jackson?
Yep.
Can I get the usual bloods as well as an ECG, please?
Sure.
Thank you. So, you were complaining of chest pains?
Oh, not pain exactly. Blame my next-door neighbour. She caught me having a funny turn and called an ambulance. She thinks she's a cut above because she's got God on her side. So how are things?
Great, thanks.
That's why you're booked in for more sessions, to tell me how great things are.
Okay, I think that's enough of that now. Come on, now. Thank you. Things are actually very good.
You know I'm trained to spot when people are lying, don't you?
Your observations seem to be relatively normal, although your heart rate does seem to be slightly low.
Have you got anything to eat?
It's a hospital, not a buffet. I'll be back.
Don't worry, you're secret safe with me.
That fills me with confidence.
Is she, any good?
You know, I thought I would enjoy talking about myself, but turns out not so fun.
So why are you bothering?
Well, because it seems to be working.
Dom.
And it was my suggestion, and I don't want to hear I told you so.
Ah. There's the Dom I know and love.
Don't touch me.
What happened?
Dr. Geller here has been complaining of chest pains and an impending sense of doom.
Hey, you see me making fun of your problems?
Okay, well, you'll be pleased to know that you're not having a heart attack.
Oh. Mystery solved. Right, what were we? Friday at 7?
Well, you can't just leave. You should run some more tests, shouldn't you?
Absolutely, yes, he's right. Are there any other symptoms that you want to tell us about?
Oh, you're the doctor, you tell me.
Well, be that as it may, is there anything in your medical history I should be made aware of?
Unless my ruptured appendix from 20 years ago is medically relevant, then I don't think so. Now, if you will excuse me, I really don't want to be a waste on resources anymore.
Oh, take it easy. Okay, come and sit down.
I'm fine.
No offence, but you don't look fine. Okay, Nurse John, can we get a leg flat, please? And I think we're going to have to do half-hourly obs and sort out a CT scan just to be on the safe side.
Is there anyone we can call for you?
Just pass me my bag, please.
Yeah. There you go. I'll be back in a moment.
Slowly. Is everything okay?
Sure. Tip-top.
You look like you're in a bit of pain.
Old age. Happens to the best of us. And the worst. So, am I earning my pay packet?
Yeah. Great, actually. Really great.
Glad to hear it.
Good.
That's not saying I believe you. People don't pay to see me because things are good, Benjamin.
Right, can you move over to the left a bit? Look, are you sure there isn't something you're not telling us?
Who's the psychiatrist here? Is he going to be much longer?
I'll go and check.
You were dragged up, not brought up, right?
Excuse me?
Extra large rolling papers. There's only one use for those.
Yeah, totally. Why?
Well, we're ready in CT. Lily's definitely hiding something from us.
I know. Low blood pressure, increased appetite, red eyes, general demeanour. She's
High.
high.
Hi.
You know, smoking a pancake, creeping a bong.
Yeah. She likes to smoke the reefer.
You sure?
Well, yeah, that, and I found extra large rolling papers in her bag.
We might look through patients' possessions up on Keller, but we don't do that down here.
Oh, they fell out. I was hardly looking for it. Anyway, let's get her discharged.
We can't just kick her out.
She's taking up a much-needed bed.
Well, if she's self-medicating with cannabis, don't you think we should find out why? She must be in a lot of pain.
So we refer her back to her GP.
You trying to get rid of her?
Look, she just doesn't need to be here.
Forget about it. I'll get her discharge papers.
You come in peace. Has Dr. Geller been discharged?
Not quite. The medical notes arrived. I've had a look through them. There's 6 visits to a GP, all concerning a history of chronic pain and a diagnosis.
Fibromyalgia. Why didn't I think of that? Good work. Check you out.
I'm bound to be right about something one of these days, eh?
Are we okay?
I want to stop our sessions with Dr. Geller.
You do?
Yeah, I know that you think they're helping, and I know that I'm the one at fault.
Look, Lofty, if I'm completely honest, I can think of many different things I would rather be doing on a Friday night.
But I thought you wanted to fix this.
Consider it fixed. I just want to be with you, that's all I want.
Should we break it to her gently?
I was thinking rock, paper, scissors.
We can do it together after we've discussed our new treatment plan.
Sure. To cast aspersions, but we suspect that you might be using cannabis.
Fine, you got me.
We've also pulled up your medical records, and we can see that you've been seeking treatment for chronic pain for a while. Your GP even made a diagnosis.
Look at you two sussing things out. She never made a diagnosis. She just ruled out loads of other things.
But she suspected fibromyalgia, which is notoriously difficult to diagnose and treat, although there are options.
I've tried them all.
Nothing worked?
Oh, but one thing worked pretty well. Look, I've seen so many doctors about this. I've tried so many pain management plans. Nothing.
So you went for the cannabis?
Turns out the grass is greener.
So what's the difference today if you've been smoking it habitually?
My contact was out of town, so I had to find an alternative supplier.
Look, we could put you in touch with a rheumatologist and a neurologist.
I'm managing it my way, thank you.
If you ask me, something's got to change. You, of all people, should know that.
He's right. We were having problems and we sought help. And now things are better.
Don't try and psychoanalyze me. You're not qualified.
The least you can do is give it a try.
Fine. think it'll help.
We do.
I take it this was our last session. It's not you, it's me, right? It's like you just said, you sought help and it worked. You know they're non-refundable, by the way.